Gotta go buy some ice. So you're gonna have it outside? What's the point?
Is that Maria? I'm gonna mute you.
Yes, ma'am.
Is that you? I'm gonna mute you, okay?
Yes, ma'am.
Unless we're having a party at your house with some ice and, is that you?
Yeah. Yeah.
Okay, that's okay. Yeah, I'm just gonna mute you unless you need something, just unmute yourself and ask.
Yes, ma'am.
Okay. Anybody else need to do that? That's fine, totally fine. But everybody else got the rest of the outline done. If not, we can put it up, but I suggest you go out and fill it out yourself by way of the lecture, just so you know what information that you're gonna need. Cool. Does everybody have their outline? Because that's what we're going to go by for like some of tonight is go by the rest of the outline, because this stuff you guys have to know for the test. And so if you don't have your outline, if y'all could get it and then maybe fill it out or make notes according to the outline. Is everybody good with that? Cool.
Yes, ma'am.
Okay. I'm just going to put this here. No, I'm not. Okay, so we stopped at the, when we started on the, I don't know, it was the third or fourth page of the outline where we finished the nervous system and got to the layers of the heart. So is everybody there? Are we all on the same page with that?
Yes, ma'am.
Okay. So I'm, like I said, it's a lot of information, but I'm going to give you what you need to know. Can everybody see my screen?
Yes, ma'am.
Yeah, okay. I want to make sure y'all can see it so that you can look at whatever I'm looking at here. Hold on, let me move it over. Let me move this. Okay, so everybody can see that my screen now with the PowerPoints. Okay. So these, let's go back. Let's see. Here's where we are, the layers of the heart. What do you need to know about that? There's 3 layers of the heart. These are the 3 you have to know. The heart has an outermost layer and it's thin and it's full of like blood vessels, and that's where the coronary arteries are that provide your heart with nutrition and oxygen. And that's on the outside. You have this middle layer to the heart called the myocardium, and you should have learned in medical terminology, myo means like muscle. So that myocardium, that middle muscular layer, that's the thickest part. That's where all of the cells that are capable of contracting are located. So that's where everything that you're going to need to pump blood, all of those cells are located in the myocardium. It's that big, thick, muscular layer. And then the inside of the heart, this third layer is made up of like some smooth, like elastic tissue. And why do you need it smooth? Why do y'all think it needs to be smooth? To allow for blood not to clot. So it allows the blood to kind of move through there slowly. You don't want it to clot or get stuck. So it's got to have that smooth layer in the middle to make sure the blood flows through correctly. So everybody good with the 3 layers of the heart? And why do we need to know that? Because everything that goes on with the heart affects those 3 layers. The heart sits in like a sac, like the pericardium. And I don't know if you studied that in medical terminology, but it means around or surrounding. So the heart is actually in this sac called the pericardium. And that sac is what protects it and keeps it safe from infection and bacteria. If something happens to your heart and it fills up with blood or it fills up with water, or fluid, it will squeeze the heart and cause like an irregular heart rhythm. You'd see an arrhythmia, it's called cardiac tamponade, but that's what happens. So just what do we need to know? That it sits in this pericardium and that there's these 3 layers. So you'll need to know that there's the epicardium, the myocardium, and the endo. Why do we need the endo? Or like, what is significant about it? Smooth. It allows for blood flow. It doesn't allow for clotting. We all good with that one? Okay. So then we have, there's your layer, there's the picture of the layers, and you can see how you've got the epicardium, the myocardium, and the endocardium. This is what we're talking about here on this picture. Those three layers, this is the outer, and then there's this sac that it sits in. It doesn't show it on this side, but this is the pericardium. See how this layer is really thick? That's that thick muscle that allows for contraction and relaxation and pumping of the heart. You're gonna have to be able to identify these major vessels that enter and leave the heart. I'll tell you what you need to know about these two. These two, the superior and inferior vena cava, you remember how we talked about superior towards the head, inferior away? This vena cava, there's a superior and inferior, and they meet in the middle basically to return blood that's O2 depleted, right? It's a vein. So the O2, it's depleted blood. It's done its job. It's coming back to the heart to get oxygen. So the superior and inferior vena cava will meet at that right atrium to bring blood back. So it's the largest vein. It returns O2 depleted blood from the upper body to the heart, and the inferior, it returns O2 depleted blood from the lower body. So when you're doing your flow of blood, you know, if you start right there, what kind of blood are you getting? Is there oxygen in this blood? No. It's done its job. It needs to get some more and go back out. The aorta, what do you need to know? Everybody has heard that aorta. It's the largest artery. It branches out of the left ventricle. It carries all this oxygen-rich blood to the body. So it'll branch off to the arteries and to the arterioles, and it's what gives the heart and it gives the body its nutrients and oxygen. If you have an aortic aneurysm, that's like a ballooned out area of the aorta, and it ruptures, you hear about people having a ruptured aortic aneurysm, that's all that blood that's being pumped with all that force will then rip through that and bleed out into the body. Usually people don't survive that unless they are in the hospital when it happened. They usually bleed out so fast that you can't stop it, because this is huge, this aorta. So what do you need to know about that? What kind of blood is in the aorta? Oxygen-rich blood. It's gotten all that blood from the heart. It branches off to the body, but it also branches to the coronary arteries, because the coronary arteries are what supplies blood and nutrition to the heart. The heart doesn't get it when the blood's going through it. We need to all make sure we remember that. It doesn't get it when it's going through. It gets it from the aorta like everything else. So when that blood from the aorta gets pumped out to the body, it's also getting pumped to the coronary arteries that feed the tissues of the heart. So everybody got that one? Everybody understand what that?
Yes.
Okay. When you're asked what it means that the heart is a double pump, just know that it's because it's pumping blood to the atrium and it's pumping blood to the body. So it pumps. You know, when you have your heart beat, you hear that double, you hear that like bump, bump. Those are the closing of the valves, but that the heart is constantly pumping. It's either pumping it to the heart or out of the heart. It's a constant closed system. So we need to know that. Why? Because when you start looking at heart rhythms, you are actually looking at that heart pumping, and you know in your mind what it's doing. So it's pumping blood to the right atrium from the superior and inferior vena cava, and it's pumping blood out of the heart by way of the aorta to the body. It's just a constant, like, closed system. He's fine. Oh, he's fine. Let's see. Now, all right, y'all, let's go to this. Major blood vessels. So here, these are your major blood vessels of the heart, the ones that enter and leave the heart. Let me get to that page. These are the ones that we just talked about, the superior and inferior vena cava. What kind of blood are they bringing?
Oxygen-rich blood.
Deoxygenated, right. Your right pulmonary artery, your left pulmonary artery. Left pulmonary veins. What are these? These are your coronary arteries. These are the ones that feed the blood to the heart and feed the nutrients to the heart. This is the only place you're going to see exact opposite of what we already talked about. The pulmonary arteries in the heart, they actually carry deoxygenated blood. The pulmonary veins carry oxygenated blood. It's just how it is. So when the blood gets pumped from the right atrium and right ventricle to the lungs, they go by way of the pulmonary arteries. So that's the only, usually when you think artery, you need to think oxygen-rich blood, except when they're in the heart going to the lungs. That artery is carrying all that deoxygenated blood. That's just how it is. So just remember this. This is on your PowerPoint. Arteries always carry blood from the heart, and veins carry blood towards the heart. The case of the pulmonary arteries and veins is one in which deoxygenated blood is flowing away from the heart and oxygenated blood is flowing towards the heart. It's just inside the heart, it works differently. Here's your the coronary arteries that we talked about. When that blood leaves the aorta for the body, it also goes to your coronary arteries. So when you think about the aorta, it gets that blood from the left ventricle and it's supplying your body with blood. We need to think about it's also kind of forking off and supplying blood to the coronary arteries. You have a right one, you have a left, a circumflex, and a left descending artery, an LAD. If you've ever been in the hospital and you heard someone die from a heart attack, or they had a widowmaker, they call this the widowmaker, because a heart attack in this left anterior descending artery, meaning it's blocked, it's clogged. You look how huge that is. It's supplying the left ventricle. It's almost always fatal.
My uncle had a widowmaker and he survived.
He did. See, it's almost always fatal, but there are circumstances where they can catch it. It used to be pretty standard, but they've come a long way. But this is what they call the widowmaker, because that surviving that is great. It's phenomenal, because that's, they can catch it early enough, they can do a bypass or they can do stenting, but it's such a large area. Okay, now we need to talk about the heart itself, the parts of the heart. So the heart is separated. Just know it kind of is separated into 4 parts. Straight down the middle is the septum. That's the wall that divides the left and right side. The upper chambers are the atrium or the atria. The atria is plural, atrium is singular. And the ventricles, the 2 lower ventricles, left and right. Which is the biggest? The left. Who's doing all the work of this heart? The left. That left ventricle is the biggest part, the most muscular, the one that's doing all the work. If you lose that left ventricle, you're pretty much done for. That's it. That left ventricle. So if you hear people having like left ventricle hypertrophy, meaning it's enlarged heart, that part is enlarged, it can't contract effectively. That's where you're having that problem. It's huge. It's a lot bigger. And that's why when you looked at the heart and where it was, it points down to the left, that bigger section, that's where you get your apical pulse, is at that left ventricle. Because it's making so much noise. It can beat on its own. If you lose it, and you'll see later on when you start to study rhythms, if only your left ventricle is beating, you know it. It's taken over, you know it. It's the only thing beating, but it can pump the blood. Not really effectively, but it can exist for a little bit. Okay, we touched on systole, diastole. We talked about that. Do y'all remember what we said about what systole was? That the top number or bottom number?
Top.
Where the heart's always working.
And what is that top number? That's the pressure, right?
Yes.
So that's the phase in the heart at work. It's contracting, it's pushing the blood out of the left ventricle. So systole is that bump, that hard push of the ventricle. Diastole is when the heart relaxes, it rests. So when you get that lub dub or you get a bump bump, you're hearing that. Those valves close, they're pushing the blood through, it's pumping out. The heart has to have some sort of rest in between. So like that will make you think, when the heart's beating really fast, is it ever really resting? No. So everything is gonna not work efficiently. It can do that for some time, that's what it's created to do, but if it's like that all the time, there's no way like for your heart to ever get rest or get enough oxygen, especially to the coronary arteries. You have to know the valves of the heart. We got the tricuspid valve. It's just like it sounds. There's 3 like flaps. It's located between the right atrium and the right ventricle. So what kind of blood comes to the right atrium?
Oxygenated.
What kind?
Oxygenated rich.
No. Where does the inferior and superior vena cava jump into?
Okay. D.
The right atrium, right? And what kind of blood is that? Deoxygenated. So that blood goes to the right atrium and it has to go through this valve to the right ventricle. So when you picture the heart, you're picturing that blood flow. But we're now talking about the valves. Just know that that valve is located between the right atrium and right ventricle. Okay, on your outline, it says pulmonary artery, but actually that should say pulmonary valve. So if you have the outline with you or you're working on it, just cross out where it says artery and put valve. We're going to talk about the pulmonary valve. The pulmonary, anything pulmonary is what? Has to do with what?
Lungs.
Lungs, exactly, bless you. Lungs. So the pulmonary valve is going to be between your right ventricle and your lungs. And the pulmonary artery, basically, because what is that pulmonary artery doing? It's taking that blood to the lungs. It's called semilunar because it has like 2 like hot moon shaped like flaps to it. So that so pulmonary valve, where is that located? Between the right ventricle and the pulmonary artery. Bicuspid valve, that right there tells you there's how many flaps? 2. This is also what you hear, the mitral valve. A lot of people have mitral valve prolapse or mitral valve disease. That is the valve that's located between the right ventricle and the pulmonary artery. So when blood goes into the right ventricle from the pulmonary artery, there's a valve. Everything has a valve because why? It has to move smoothly and efficiently. Those valves have to open and close exactly perfect or stuff happens. Clotting, backup, we'll talk about all that. But in a perfect heart, they all close in sync. The tricuspid and bicuspid close and the pulmonary and aortic open. And the pulmonary aortic close, the tri and bi open. So it really works in sync, ideally. Aortic valve is exactly what it sounds like. It's the valve from the left ventricle to the aorta. And it's semilunar as well. They call it the aortic semilunar valve. Mitral valve is the one you will hear a lot about because it wears out. And if it wears out, then blood is not going to flow correctly from your pulmonary artery to your right ventricle. And so then you have to think, well, what is that going to do? It's going to cause blood to back up or pool. So they have to close and open efficiently, or you end up with a lot of heart problems, lung problems. Everybody got those. Remember these, you will see them again. It's divided into 4 chambers. There's 2 on the right, 2 on the left. The septum divides the right and left. The upper chambers are called the what? Atria. The lower are the ventricles. And they contract and relax in a rhythmic pattern to pump and receive blood. Everybody understand those? You're going to have to know that left and right. So this is what you have to know. This is just commit this to memory. I should be able to ask you, like, right atrium receives what kind of blood? Oh my.
Deoxygenated blood.
So the right atrium receives deoxygenated blood, right? From where? Yeah, and that's where you'll know, you pick it up, but where does it get it from? What 2 things are dumping into that right atrium? If it's getting deoxygenated blood, where's that coming from? The body? Through what? Superior and inferior vena cava. So everybody got that part? And this, we will spend as much time as you guys need. You have to tell me what you do and don't understand. I've got pictures of it, but this is the key to everything else we're gonna do, is learning this blood flow. So ask away. So right atrium receives what kind of blood?
Deoxygenated.
From where?
Body.
Body.
And through what? Like, and what veins? What is it coming from? Superior and inferior vena cava. That huge like vessel that's in the body that comes back to the heart, that's pumped all that blood that's now deoxygenated and all the waste products, it comes back to the heart by way of the vena cava. So you have the superior, inferior, and they are returning all that to the right atrium.
Which one comes first?
Which they're both, the superior and inferior both meet together. So if you look at the picture of the heart, which I have it here, hold on.
Do they meet together?
They do. They both dump into the right atrium. Let me see, I have a picture here for you. This, if you look at this picture I have on the screen, you see this blue, what do we think about blue blood? It's deoxygenated, right?
Right.
You see here, this is the superior vena cava and this is the inferior. This is bringing blood from like the head, the arms, the upper trunk. This is bringing blood from the feet and legs. This is the inferior and superior. Where are they going? You can't see it, it's behind, but they're gonna both jump into the right atrium.
Okay.
So when you're looking at this heart, you know this is the right atrium and this is the left atrium because you're looking at it from forward. But if you turn around, if you imagine that you're standing like this is your heart and you look like it's right and left, this is right, gets the deoxygenated blood. And then it goes, right atrium, you see, here's your, it goes through the tricuspid valve to what? What is this part here? Right, it's still on the right, so it's the bottom. What do we call that? Ventricle.
Ventricle.
The right ventricle. So the right atrium, right ventricle. The blood gets pumped here through this valve, this pulmonary semilunar valve, to where? The lungs. And it goes through the lung, it goes through the pulmonary valve to the pulmonary artery. That's the only place you're going to find an artery with O2 depleted blood. I know this seems like a lot, but once we just keep reiterating it and you draw it on your paper and you write it down, you get a feel for it, it'll come like that. So the blood is deoxygenated and it comes from the superior and inferior vena cava. That's the only place it's coming from. And
Deoxygenated blood.
Deoxygenated, exactly. And it is going to that right atrium. And it's going through the valve. Right atrium receives all that blood first. And it goes through the tricuspid valve to the right ventricle. And then it goes from that through this pulmonary valve. And you see this picture is a good, shows you the valves. You know, you have your tricuspid valve, your pulmonary valve. This is your aortic valve. This is your bicuspid valve. This is that mitral valve. And what is the point of these? They're keeping the flow. So if I had mitral valve disease and this was not letting blood flow clearly, what's going to happen? My heart's still going to pump. This blood is not going to flow. It's either going to pool up here and cause a clot, or it's going to leak in here and have ineffective pumping. And when someone says, you listen to someone's heartbeat, and you will hear it, I'm sure, in your career, what you're hearing is instead of that nice, lub-dub, like that, the heartbeat, that boom, boom, you're getting almost like a swish or like a shh, clip, like a boom, shh, boom, shh. Like you're going to hear it. It's going to sound like a swish rather than a close, because it's not closing effectively. Or you get a little extra in there because it's maybe closing twice as fast. A heart murmur just means there's a little extra something in there, the valve, because what you're hearing are those valves. You're not hearing the heart beating. You're not hearing the right atrium beat and the left ventricle beat. You're actually hearing the valves close. So that's what you're hearing, right? That tricuspid valve and bicuspid valve and the aortic valve and the mitral valve, you're hearing those things. And that's why we have to think about this. Is affected by these valves working right. So anybody have questions about the valves? I'm going to go back here to this blood flow. So the right atrium receives deoxygenated blood from where?
The superior and the inferior.
Right. And it pumps it to the right ventricle. So we got this flow. It's a closed circuit. We know that is never going to change. So if you commit that to memory, you're on a roll. Right atrium, and it pumps to the right ventricle. And where does the right ventricle pump that blood? So the blood's still deoxygenated, right? And where's it going? It's going to the lungs. How's it getting there? By the pulmonary arteries. So we have this deoxygenated blood. It's brought back to the heart from the superior and inferior vena cava. It's pumped to the right atrium. It's in that pumping motion, it goes through the valve to the right ventricle. It goes through the valve to the pulmonary arteries, and it goes to the lungs. And what happens in the lungs? It gets oxygen, right? So but when it gets to the lungs, guess what? It gets into the lungs, it gets oxygen because it goes down to the alveoli, right? And it has an exchange there where it's getting all this oxygen we breathed in, and then it's able to be pumped back out. And where does it go after it leaves the lungs? To the left atrium. So it goes to the top, and then it gets pumped down to the left ventricle, Mac Daddy of the heart. I love the heart. That's why I've studied cardiac for years. That left ventricle is the powerhouse. It's the pit bull of the yard. It's like the big Mac Daddy. If your left ventricle isn't working right, you are not getting blood to your body. So once that oxygenated blood gets to the left ventricle, it gets pumped out. How? Where does it go? It goes to what? The other Mac Daddy, the hose, right? The aorta.
Left ventricle.
The left ventricle, and it gets pumped to the aorta, right? And of course, anytime it gets pumped out, there's a valve. So it gets that aortic valve, and it goes out into the aorta, and that blood is carried to your body. But it also gets carried where? to the coronary arteries, right? Because your heart has to get blood and nutrition and oxygen. And where's it getting it? From the coronary arteries. It does not get it when it goes through. I know last semester we had a lot of there was a lot of confusion like that. We spent a lot of time on this because, I mean, you just never really learn that in school. Like you just don't ever really think about how your body is getting oxygen and how it's picked up. A lot of people thought it just, as it went through the heart, it got oxygen, or however, like it didn't, like we didn't realize that there's this circuit. So you have a pulmonary circuit, and that's on your outline. These are closed, they're all closed. Your pulmonary circuit is what? It's the blood between the lungs and the heart. That deoxygenated blood has to go to the lungs to pick up oxygen, and then it has to go back to the heart and get pumped to the body. That's your systemic circuit or your circulatory. That's where the rest, all that oxygenated blood gets sent out to the body by way of the aortic artery. And it goes down. Remember how we looked at that little webby looking thing? It goes down to your arterioles, and then it gets exchanged, right? It gets exchanged over the capillaries, and it goes back to the veins, and it goes to venules, then it goes to the veins, and where does it go from there? Superior, inferior vena cava. So it makes a cycle every time your heart beats. That's what's happening. And so it's kind of cool to think about that, because every time your heart beats, if you feel it now, that blood is being pumped to your feet, to your legs, to your lungs. It's pumping all the time. That's why we got to keep our hearts healthy. So ask questions about this, because this flow of blood is the key to learning your rhythm strips, because you know what's happening. And why is it doing this? Why do we have like this exchange site? So when your body pumps to the body, your heart pumps through the aorta, and it goes down to the capillaries, and it makes this exchange. What is it? Why is it doing that? Because it's trying to maintain what?
Homeostasis.
Homeostasis, right. That's the chemical and physical functions of the body to maintain its balance. So if you see that on a test, like what happens in the capillaries, an exchange is taking place. And why is that taking place? To maintain homeostasis. So everybody got those two. Everybody, please ask questions, because that is like the key to figuring this out. Memorize that cycle, because no matter where you start on that cycle, if I said to you, after the blood leaves the lungs, it's now oxygen. If it's leaving the lungs, it's got what? It's fully oxygenated, right? So if I say to you, tell me what the cycle is after it leaves the lungs, you should be able to just tell me. It goes through the pulmonary veins, to the right ventricle, to the left ventricle, to the aorta, to the body, to the capillaries, to the veins, to the superior and inferior vena cava, and back to the right atrium. You should be able to just know that that's what's happening. I know this is fast, but trust me, it's not over, because we will revisit this again and again. So has everybody kind of got a handle on that? The valves, the parts of the heart, what we're actually looking at?
Yes.
Okay. Heart's valves keep blood flowing through the heart in the right direction and at the right time. What do you think the health risks are if they aren't working properly? We talked about this, but it is on every exam I've looked at for the certification. What is your main concern then if your valves aren't working properly? So we have to know what the purpose is. What's the purpose of the valves?
Pump blood.
To pump blood, right. The purpose of the valves is what? Keep that blood doing what? Flowing in the right direction, right? Once it pumps and closes, it doesn't allow that backflow, right? It's closed. It's not going to allow it to go back to the right atrium. It's going to the, pulmonary artery. So once that valve closes, it keeps it going in the right direction, right? Because it's going to open. It's a constant fill, empty, fill, empty. If it's not closing right, what do you think can happen?
Heart attack.
A blood clot.
A blood clot. A blood clot can lead to a heart attack. So yes, you're correct. But think about your valves. If they're not closing properly, that blood is not being stopped, is it? So if it's not being stopped, it's going to allow for like a buildup. You can risk having a clot. I've seen a clot the size of a golf ball in a heart because those valves were not closing. It can allow for leakage in the heart. If the blood gets backed up, think about this closed circuit. What's going to happen? If my mitral valve is not closing properly and it's making the blood back up in my right atrium, where did that blood come from? I mean, my left atrium, I'm sorry. Where did the blood come from? See, that's how you have to know this closed cycle. It came from the lungs, right? So if my blood is being backed up because that valve, what's going to happen to the blood? It's going to it's going to backflow into the lungs. Am I going to be breathing right? No.
No.
I'm going to start having shortness of breath because my lungs are going to be full. I'm not going to be able to breathe. So if you have a patient who's having a mitral valve replacement tomorrow and you go in to do their EKG, would it be normal if they had shortness of breath?
Yes.
Yes, because their mitral valve is faulty. They're having it replaced. And what do we know about the mitral valve? It's keeping the blood from backing up. So if it's not flowing properly, then you could say, oh, okay. So if your question was, exactly what I just asked, if your patient's having a mitral valve replacement tomorrow and you're doing their EKG for the final time tonight and your patient was slightly short of breath. Now, if they're short of breath where they can't talk or they're out of their mind, that's one thing. But if they were like me, talking fast like I do and couldn't keep up their breath, would you think that was okay?
No.
But would you though? What you know about this person having a mitral valve replacement tomorrow, would they be slightly short of breath? Sure.
Yeah.
Their mitral valve is faulty. If it isn't closing, they're going to have backup. It's going to back up to their lungs. They're not going to breathe well. So you just have to think, what is the point of the mitral valve, of any valve? To keep the blood flowing in the right direction at the right pace or the right time. So yeah, would I expect this person to have shortness of breath? Yes, my mother had a mitral valve replacement years ago. One of the first signs that we took her to the doctor was that she couldn't walk down her driveway without becoming short of breath. That tells me there's a problem going on, either her lungs or her heart. I figured it was her heart. She has a history of atrial fib. It was her mitral valve. It was sluggish. It happens as you get old. It doesn't close right. It was allowing the blood to back up to the heart. It could not pump that blood efficiently. So it's backing up. So when she would walk, she'd get short of breath because her valves could not keep up the flow of the blood. So when you'd hear it, it would just be like a swish, pump. So swish. So that swish was like her mitral valve just kind of, instead of like this, it was closing kind of like this. So it was literally just letting the blood, it was getting some of it, but it wasn't stopping the flow. So just know that the valve's purpose is to keep that blood flowing in the right direction. It has to go in the right direction because if it doesn't go in the right direction, it's going to back up. Right?
Yes.
So if you have that, like people have congestive heart failure, it's because their heart is not pumping well enough to keep the blood flowing. So it backs up. Everything backs up. Eventually, what's going to happen? The blood, all the fluid, is going to back up to the legs and the feet. You see these people with like puffy feet. If that same person had edema or swelling in their feet, would you think, oh, this would be normal for mitral valve? Of course, because if it's backing up to the lungs, it's backing up everywhere. So you've got to keep that efficiency. That's why you guys have to know about these valves. Plus, when you start reading rhythms, it's going to be important as to diagnosing whether this person's problem is in the atrium or is it in the ventricles. You will know how to do that. You will be able to look at that and say, yeah, there's a problem in this left ventricle. This person this is bad, like, because you know the flow, you know what it's supposed to do. This is what we were talking about. Know your circuits. Pulmonary circuit is exactly what it sounds like. It's the flow of blood between the heart and the lungs. It's a closed system. The systemic circuit is what? It's the flow of blood between the heart and the rest of the body. And what are your exchange sites? What is that significant for?
Carbon dioxide.
Right, it's exchanging the oxygen, the good blood, for the bad blood. It's where the oxygen and all your nutrients take place, and the cells are delivered and removed. So you have like those capillary beds, that's where all the exchange takes place. And you remember we had that the graph with the little web, and it showed like the blue and then the red. That's your exchange site. That exchange site happens in the lungs too. Where does that happen?
The villi.
Alveoli, right. This is your pulmonary circuit. Pulmonary, you're automatically thinking what? Lungs?
Mm-hmm. So
here's your pulmonary circuit. It's coming from the heart. It's going to the lungs. It's coming back out. You see this circuit? It's totally closed. It's going from the right ventricle to the lungs and back out to the heart. It happens on both sides. It goes here, it goes down, it splits here. This is your right and your left. Does everybody understand this flow of your pulmonary circuit? I know it seems overwhelming, right? Why are you laughing, Terry?
Because I'm just trying.
You're what?
I'm just trying to understand it. It's a lot.
It does seem like a lot, but you just have to back up and just think about basically, and for me, I have to understand something to learn it, but if you can memorize these things and memorize keywords, it'll be a whole lot easier. If you know that your pulmonary circuit, if I ask you about your pulmonary circuit, you already know pulmonary means lungs. If you go to a pulmonary doctor, that's a lung doctor. If you have a pulmonary unit at your hospital, you know that's all about the lungs and breathing, right? So you know that your pulmonary circuit is the circuit between, what are we talking about? Heart and lungs.
Heart and lungs.
That's all we're doing. That's all you really have to understand from this, is that this pulmonary circuit is the exchange of deoxygenated blood and oxygenated blood. And it happens in the lungs. It seems really like when you draw, I had one person, like I said, that drew the entire circuit, like superior and inferior vena cava to the right atrium, to the right ventricle, to the pulmonary. She drew it out at the top of her test because that's how she needed to learn it, as just a cycle. And I am the same way. She stayed after class, we drew it on the board, we drew it every which way. That's, I think, unfortunately, I'm sorry?
I do that in my notes so I can understand it and like write it out on the sides and color it so I can know how it flows.
Right, you just have to do whatever works for you. That works for me, like drawing it out on the board, learning the flow, looking at it, like actually physically doing it. Like if we were all in class, like you wouldn't be able to just sit there and be quiet, because I would not let you, because I would be like, here, draw it for me. You like draw this, because it's just about the whole repetition of this system. But if you can put this and commit this to memory, it makes so much more sense. So whatever you need to do to commit it, if you need to have me do it one-on-one, or we can go on screen and I can draw it down, like fill in the blank, because no matter where you start on this system, it all ends up at the same place. So your pulmonary or your systemic circuit, they all end up the same place. So these key points, deoxygenated blood, you already know where that comes from. The body, right? After it's exchanged, it comes by way of superior and inferior vena cava. It goes to the right atrium. Okay. Oxygenated blood, are you ever going to find that in the right atrium? No. If you do, you have a problem. Oxygenated blood is received from the lungs in the left atrium, then pumped from the left atrium to the body. So the atrium are on the top, ventricles are on the bottom. The last place that blood is the left ventricle, right? The Big Mac Daddy. It's going there and it's going to be pushed out into the aorta. If you have an aorta problem or left ventricle problem, you have major problems, right? Because that left ventricle is that big muscle that's just pumping and has all that, like when you hear about these like student athletes that die young, and it's because they had like an enlarged heart and they were out on the football field and they fell over dead. It's because no one thinks that a teenager can have an enlarged heart. When your heart becomes enlarged and you're working it like that, like on the football field, it's so big and muscular. It does not work effectively. It becomes enlarged and that muscle cannot contract, and they have sudden cardiac death because it causes an arrhythmia, which causes you to die. So that left ventricle, that last part that it leaves, that's all that oxygenated blood that needs to get to your body. So you just have to keep thinking like, okay, I know the left ventricle is where all that oxygenated blood, where did it come from? Came from the left atrium, right? Because it goes from the top to the bottom. So the left side of your heart has what kind of blood?
Oxygenated.
Right. The right side of your heart has what kind of blood?
Oxygenated.
D.
Yeah.
The right side. The right is wrong. Ha! That will really confuse you. But yeah, like for me, I have to make stuff up. Like, what is the right side of my heart? Ugh. Like the left-handed people, I'm always envious of because they look kind of cool while they're writing. The left side is the cooler side because it's got the blood and it's doing the job. That right side of your heart is getting all the junk. It's getting that leftover blood. There's no oxygen in it. It needs to just send it on. So it's receiving like junk. This is your systemic circuit. So we know what the pulmonary is, right? Heart and lungs. Systemic is what? The heart and everything else. So
Except the lungs.
Except the lungs. So you see this here is what? Your systemic. You see how the lungs are here? So your pulmonary, sorry. Everybody see that? This figure 8 in the middle is your pulmonary circuit. There's your aorta. You see that big dog coming out of here? That is your systemic circuit. There's your exchange taking place and bringing the blood that's deoxygenated back to the heart. That's what's happening here. Blood's being pumped out. It's going up here. It's being exchanged for the crappy blood. It's coming back from the superior vena cava back to the right atrium. So your inferior vena cava and your superior vena cava, they meet and dump all this crappy blood where?
right.
Right.
The right what?
Right.
Right atrium.
Exactly. The right atrium. Because this is deoxygenated. It's coming from all over. It's just a constant flow. And that's why I say if you can memorize this flow, then you know what's going on. Because this has to happen for your feet, your tissues, your organs to get blood, to get oxygen. And the biggest purpose is to carry oxygen, right? Carry oxygen and nutrition, nutrients. So if you're having heart failure, this is not working right. So you have pulmonary circuit and a systemic circuit. This all has to take place. And just think about this surface area in one heartbeat. So if you feel your heartbeat and it's 90 times a minute, that's happening. That that heart is having to pump. That's why heart health is so important, because it's doing all the work. So what's going to happen when you have heart failure? All this is going to back up. If I have congestive heart failure, congestion is what? It's like a buildup of junk in your lungs. If you think, oh, I'm congested, I have this cough because my lungs are full. If you have congestive heart failure, then what's happening? Congestion in the lungs, which is causing a backup of blood, of fluid. I mean, in the heart, where's it happening? In the heart, in the lungs. I might have swollen feet because is this blood going to be able to back up? If I'm not pumping effectively, what's going to happen when I'm on my feet all day? I'm going to be swollen because my heart is not effective enough to pump this blood back up to my heart. So it just sits there, pools there. And what's a risk of blood pooling?
Clotting.
What? Clotting.
Clotting.
Know
Heart
that.
attack.
Clotting. So know that for the test and for your other test. When blood pools, it does what? Clots. So if your blood is pooling anywhere, you are at risk for a blood clot. That's why people sit on an airplane. If I sit here at this desk too long without moving, without pumping my feet, what is happening to the blood in my lower extremities? That's why a lot of people, it's pooling there and it can cause a clot. You hear about people on airplanes, they've ridden on an airplane for 6 hours, they get up and they have a blood clot in their lungs. Where did that come from? Their lower extremities. They sat too long, the circulation was poor, and it allowed for the blood to clot because it was not moving efficiently. Plus, when you're in an airplane, you know, your oxygen level's low anyways, so you're not drinking enough fluids, you're not moving, the blood's gonna pool, you're gonna throw a blood clot. That's why when you go in the hospital and they put compression hose on you. Why are they doing that? To squeeze the fluid and the blood out of to help your heart, to help that fluid move around so you don't have clots. So there, everybody, I mean, ask questions, speak up, because this is where all that like critical thinking is going to come in when you're starting to read rhythms. Everybody got these two systems down pat. I think all of y'all need one of these because y'all are just way tired. And also I would have brought like candy to the class because I feel like a little sugar or nutrition, granola bars will help you think better. So some sugar, Red Bull before your test. We'll go over the test later, but. So what are we remembering about the systemic circulation? It's delivering what? Oxygen and other stuff. Hello?
Oxygen and nutrients to the whole body.
And takes away what?
Carbon monoxide.
Carbon dioxide.
Right. Blood leaves the heart from the aorta and returns through the
vena cava.
Right, the superior. Have you ever heard of somebody having an IVC filter or Greenfield filter?
No.
You'll probably hear that. They used to do them a lot. They shouldn't do them a lot now, but they still do some. You sometimes see it on TV, like advertisement for like an attorney. If you've ever had an IVC filter and problems with it, that is an inferior vena cava filter. IVC means inferior vena cava. If you have you're at risk for clotting and you go and have abdominal surgery, which has huge risks for blood clots, they will go in through your femoral artery and put in IVC filter. They'll go in your inferior vena cava. They'll put in this thing that looks like kind of like a umbrella, upside down umbrella, and it actually sits in the vena cava like this. So when the blood goes through, if you've had any blood clots that traveled up from your legs, it catches them. And then the body will naturally dissolve them, but it catches them before they can get to your lungs and heart. They used to do this a lot. They will do it sometimes now if you go in for surgery and you're at risk for clots, they'll put one in that's temporary and then go back in and take it out. But it acts as a filter. So that's inferior vena cava filter, because most blood clots that cause heart, lung, brain problems, they will come from the legs. So your legs, if your legs tend to swell, you need to put them up, you need to walk around, wear compression hose, because the risk of blood clots traveling to your heart. And what happens when a clot gets in your heart? It can go to your lungs. It's going to cause you to have a PE, a pulmonary embolism. It can go to your coronary arteries, so that clot can travel. So when blood pools, you're at risk for what?
Blood clotting.
Right. So you're going to hear this a lot, that your cardiovascular system and your respiratory system, they work together. If you have a problem in one, you are eventually going to have a problem in the other. You might have one immediately or acutely, or you might have one that's chronic or long-term. Why is that? It's because the cardiovascular system is what's providing the oxygen, right, to your body. So anything that's wrong in either one of those systems is going to actually affect the other. So like, just say if you had asthma. Anybody have asthma here?
Me.
You don't have to say that. You don't have to display your medical stuff, but what happens when you have asthma, right, is your respiratory tract actually flowing properly? No, it clenches down. It becomes blocked. That's why you need an inhaler to open it back up. But what's not happening then? If your lungs are not opening up properly, what's not happening?
They're not receiving the oxygen.
That's right. Can the blood get in there and get down to like the alveoli to get the oxygen it needs to supply the body? No.
No.
So that's going to cause problem in your cardiovascular system, because then is your heart getting enough blood supply and oxygen? No. Is your body? No. What if you're having bleeding? That was one of the questions on the last test. Bleeding can cause what? Hypotension. It causes your blood pressure to go down, right? It causes your heart rate to go up. So bleeding, if you're bleeding out, what is then happening? Not enough blood is getting to your circulation, right? Your respiratory system is working fine, but is oxygen getting to your feet and legs?
No.
No, why? Because there's not enough blood, right? So if you're bleeding out, that you may be short of breath. Why? Your body's trying to provide homeostasis. It's trying to get you to breathe faster, to take in more oxygen, because there's no oxygen getting to your liver and your bowels and your legs. Why? It's not having anything to do with the lungs. It's because you're bleeding out somewhere. The volume isn't there to take the oxygen. So again, those two work hand in hand. Everybody good with those two?
Mm-hmm.
What if you had fluid in the lungs from heart failure or any other problem? Like maybe you had pneumonia and you have fluid in your lungs. What's going to happen? What happens to that surface of the alveoli is taken up by fluid or pneumonia, right? So then what happens? You're not getting enough oxygen to your other body systems. So you feel crappy otherwise because you're not being oxygenated and the CO2 is not being brought out. It's not happening good enough to make everything work. So just know if you're asked about the relationship for those, you know that one affects the other. It may affect it long-term. It may affect, acute. If you're bleeding out, is that going to be an acute symptom? Are you going to have acute problems? Yes. You're going to have long-term problems? No, because all bleeding stops eventually and it doesn't take very long. So you're not going to take, you're going to have like immediate problems. But if you have congestive heart failure over time, is that going to cause you a problem? Yes. So just know there is a relationship between the two. We talked about that. Marathon runner has a case of bronchitis. Well, we know what's going to happen. We know what happens with internal bleeding. These are like what we talked about. How does the body maintain homeostasis? It's a physical and chemical process that provides balance, right? Mm-hmm. How about the location of the heart? Where does the heart lie? What cavity is it in?
Thoracic.
cavity.
And it sits between the right and left.
Hold on, let me get my
the lungs, right? It sits between the lungs.
Oh yeah.
Yep. And what is that space called?
The median stern or
mediastinum. So if you're asking location of the heart, if you have to write that down, you're going to just say it's in the thoracic cavity between the right and left lungs in the mediastinum. So your blood consists of what? What two things?
Plasma.
Mm-hmm.
And plasma and formed elements.
Right.
Yeah.
And what are the formed elements?
Nutrients.
It's leukocytes, erythrocytes, and platelets.
Thrombocytes.
Thrombocytes.
Which are also what? What do the thrombocytes do?
Stop clotting.
Blood clot?
They help with clotting because you need your blood to clot, right? You don't want it to clot inside your leg in an artery. But if I cut my leg open, what do I want my blood to do?
clot up to stop the
Clot.
bleed.
That's why you have people, I'm sure you know somebody who's on Coumadin or a blood thinner or takes a lot of Motrin, ibuprofen, and they bleed and it's hard to get them stopped. That's what the risk of being on Coumadin for a blood thinner, because you can bleed out. You can bleed to death. Your body does not make the clotting factor that you need to stop that blood flow. So it thins the blood too much. You need the clotting factor. So you want your blood to clot, but you don't want it to clot abnormally inside an artery or a vein, right?
Yes.
Okay. So your arteries are what? What kind of blood do they carry?
Deoxygenated.
What kind?
Oxygen rich.
Oxygen rich. And where do they carry it away from?
The heart.
The heart.
The heart.
The veins are what kind of blood?
Deoxygenated to
And
the
where
heart.
brings it to the heart? Where's the only place that is not true?
Inside the heart.
Right, for the pulmonary artery and vein. That's just split. So your pulmonary circuit is what?
Heart, lung.
Heart and lungs, and then your systemic circuit
Whole body.
system is your whole body and your heart, right? Really your heart and the rest of the body. So what happens when your sympathetic nervous system is stimulated? Remember that?
Experience stress, fear, or a threat.
So sympathetic, what happens to your body then?
It's fight or flight.
Right, and so what happens? What's gonna happen to my heart rate?
Heart rate goes
It's gonna increase my heart rate.
Right. What's it gonna do to my breathing?
Faster.
Mhm. So then what's got to happen to bring me back to normal, to maintain homeostasis? What's got to happen with that?
You have to calm down.
What calms you down? What kicks in?
Parasympathetic.
Right. Your parasympathetic system kicks in. It brings your heart rate back down, brings your breathing back down. It increases your digestion, because when you're in fight or flight, your body will physically like stop or slow down digestion to allow for blood and circulation to go to those parts that need it most, lungs and adrenaline. So what's the function of the valves in the heart?
Helps to blood to flow in the right direction.
Right, at the right time in the right direction, or else what happens? It backs up.
Backflow. It's gonna backflow the blood and blood clot.
Right. How does the heart receive oxygen?
The aorta branches off
What?
into the main coronary blood vessels.
So the coronary arteries, right? Just know that coronary arteries supply oxygen and nutrients to the heart. It's not the atrium, it's not the ventricles. It occurs when everything else gets blood, the heart gets blood at the same time. Because I love my dogs, I always associate it all with dogs. Like everybody gets fed at the same time. But who's getting really fed first is that big left ventricle, because that blood's going right there to it. Those coronary arteries are feeding the heart, that left ventricle. They're getting really fed first, but everything goes out at the same time. But that left ventricle, those coronary arteries, they are getting their blood supply after it leaves the aorta. What happens to the heart muscle during diastole? What is happening here?
It relaxes.
And what's happening here?
It's pumping.
It's pumping, or what? What word do we use? What's happening in there? It's contracting.
Contracting.
Right. So is everybody able to track this path of blood from the inferior and superior vena cava to the aorta? Like, is everyone comfortable with that? I have some other the other handouts I sent y'all. I haven't pulled up. But. How about hypoxia. Give me 2 signs of hypoxia. What is hypoxia?
Not enough oxygen to the body, to the tissue.
Right, a decreased oxygen. So give me 2 signs of hypoxia that you would be able to recognize, like right off the bat.
Blue nails, bluish nails,
Or
and pale
lips.
skin.
Not pale skin, because I might get pale while I'm sick or have fever.
Oh,
What else
okay.
happens when you don't have blood? Yes, your nails can get blue. Your
Confusion,
skin-
anxiety.
Confusion.
State of mind.
Right, altered mental status. Because
Blue
what's
around
happening?
the mouth.
Well, blue around your right. So anything cyanotic. So anything blue is one of the classic signs of being hypoxic. The other one is altered mental status. If I'm not breathing well, oxygen isn't getting to my brain, so my brain can't function, right? So if you go into a patient and they were fine when you saw them last night, and tonight they look a little blue and they are really confused, your first instinct is that this person is not getting enough oxygen. You need to get somebody, they need to get some oxygen. So hypoxia, like 2 classic signs that you might need to know would be that bluish color, cyanosis, and altered mental status. Everybody got those?
Mm-hmm.
Yeah.
Hold on, let me get another page. So let's see. Can y'all see that?
Mm-hmm.
Did it change to this picture of the heart?
You got a bunch of different pictures.
You don't see this, like the heart.
Yes.
This one you should see. This now, can you see like the heart with the blood flow? Okay.
Yeah.
This is just, I think I sent you guys the handouts that had these on them.
Yes.
So it comes from the body. What are these 2 here? This and this. What are these?
Intra and superior.
Inferior?
Yeah, I meant inferior.
It's okay. And superior. Vena cava, right? And
Uh-huh.
where do they go? What is this?
Right.
Right ventricle.
That's over here. What's over here? Where's the first place
Right
it goes?
ventricle. I mean,
Nope.
atrium.
Right.
Pulmonary valve.
Well, that's here. But where do these 2 go? Into the right atrium. So if you have a list of steps and it says your superior and inferior vena cava, go and dump their blood where? To the right atrium. This is where it all happens. This is where your start of your electrical impulse should happen. This is where it all starts. So I think about like the atrium of a hotel, like that's when you go to check in, that big atrium that you go to, that's where you're going. Like that's where it's going first. Left or right? The left or right? I'm sorry, it's right. Right atrium. Right?
I'm confused.
I confused myself. Where does it
From
go?
the superior vena cava to the right atrium,
Yes, the right atrium.
and then to the right ventricle.
Yep, then to the right ventricle. And then what is this?
The
Pulmonary.
Pulmonary artery.
Right, because it's going here to the right lung and here to the left lung.
Then left atrium.
Then it's coming in to the left atrium,
And then left ventricle.
left ventricle, this big one down here, and then it goes through the valve to the, to the aorta, right? And then to the body. So it really makes a big like circle, right? The aorta goes to the body, to the coronary arteries, here you are, and then it's gonna come all the way back with its deoxygenated blood and come back to the inferior and superior vena cava right here to the right atrium. And that's where it all just starts over again. So one full heartbeat is this happening. See, that's like just a circle. Does that make sense? No?
Yes.
Yes.
Let's see. Did you guys get, let's see. Can you see this picture? The basic anatomy and function of the heart.
Yeah.
That came up, the new one. This is just gives you a different picture of it because everybody's going to learn this a different way. But again, what are we looking at here? What is this? The superior and inferior vena cava, right?
Mm-hmm.
Where's that blood going? What's this little
Right
chamber right
atrium.
here? Right atrium.
Right atrium.
And it's going to go through this tricuspid valve to the
Right ventricle.
right, and then it's going to go through the pulmonary valve because it's got to go through a valve.
Pulmonary artery.
Yep, and then it's going to go where? To the right and left.
Left atrium.
Lung.
Left and it's going to go to the lungs first because it's got to pick up oxygen, right?
Yes.
So it goes to the lungs and it comes back into the left atrium. And then it goes from the left atrium where? Through this mitral valve to the,
Valve.
to what? What's the big dog down here called?
Left ventricle.
Left ventricle. And then it goes through the what? The aortic valve up here to the aorta. And that's where that's going to split off to like the head and neck, the coronary arteries, the feet and legs. This is carrying all that oxygen-rich blood. And then where's it go? It goes to your arteries, your arterioles, the capillaries, exchange takes place, and then it gets sent back by the venules, the veins, and back here again. It is a total, it's just a closed system. This is what's happening in a heartbeat. This is what's happening when you're reading an EKG. When you see that, you know, rhythm that you see on the monitor, this is one heartbeat. That is what's happening. The blood is being pumped. This is mechanically what's happening. What do we know? That there is mechanical and electrical activity. Why? Because that's where the EKG is, right? Are you picking up this? You're picking up electrical activity on your EKG. But your electrical activity is telling you what's happening. So that's why this is so important to know, because when you're reading that EKG, you will be able to look at it and tell where there's a problem. Because you know that the beginning of this heartbeat is taking place right here. Does everybody got like this down? Is it confusing? You need it another way? Is it just a memory thing? Like, it probably looks foreign, but it literally will get easier. Just know this is part of the stuff I sent you. It gives you all the same information, just a different way.
So when it leaves the right atrium, it goes where?
To the right
Ventricle.
ventricle, to
Then
the
pulmonary artery.
right here.
Then
Then
to the left
right
atrium.
and left, what?
Oh,
For water again?
Okay, so it goes from the right atrium to where?
I know.
Right
to
ventricle.
the right ventricle.
Then it goes through the,
Pulmonary artery.
and goes to where?
Left and right lung.
Because you got to pick up the oxygen. Then it comes back by way of the pulmonary
Left.
veins, right?
Yeah.
To where?
Left atrium.
Right, and then where? Or correct. Then where?
Right. And then left ventricle.
Right, and then it goes through this valve, the aortic valve, to where?
The body.
To the aorta. Because where's it going from the aorta? It's going to the body, correct? And it's also going to the, how's this bad boy getting all of its oxygen?
Lungs.
No. When it leaves the aorta, it goes to the body and it goes to the coronary arteries. Right? Because how does this heart get its oxygen and its nutrients?
The coronary artery.
The coronary arteries that branch off of the aorta. So the aorta is like huge, like it's big, it's huge. You hear about these people having like an aortic rupture. Those people rarely make it. If you do, they have a lot of problem because that blood is being pumped. That's why when you cut an artery, if you've ever seen like these crazy like CSI shows, if you cut an artery, what does that blood do? You see it's spurting. Why? Because the blood is being pumped from the heart. Like there's all that force. So like you'll see crime scene and there'll be blood spatter everywhere. That is the blood because it's being freshly pumped out of the heart. Does that maintain long? No. But for the first few minutes or first few seconds, like you're gonna have that force of the aorta of whatever's being pumped. Those arteries are gonna be, it's gonna just pump that blood. If you cut a vein, does it pump like that? No, because there's not a lot of pressure left. There's no pressure. If you cut your finger, you're cutting, you know, those capillaries in your finger, the veins. Is it gonna spew out like that? No, there's no arteries in my finger. But if I cut my wrist and I cut here where this artery is, what's gonna happen to that blood? It's still getting the force from this heart out. So that's why you get that force still, because the blood is still being pumped from the heart. If you cut a vein, is it still getting that force? No, because where's all your force? You know, force slows down as it goes. So your major force is going to be here, right? And into the body. Once it gets into the veins, it's really just a matter of being moved back to the heart because this is being pumped. So you're pumping this blood out to the body and then it's just being returned, really, because this is pumping behind it. So this is the pump maker. This left ventricle is that why it's so big. Muscle is thick and it's pumping this blood with all that force to the aorta, to your body. And it's just a closed system. Does that make sense to everybody? Why that's happening?
I get stuck. Well, like after the blood goes to the pulmonary artery, it goes to the left and right lung. Where does it go? It comes back to the pulmonary artery.
It comes back to the pulmonary vein. Because that's what's bringing, the pulmonary vein is what's bringing it to your right, I mean your left atrium. That's the only place you're going to see where blood is different. You know what I'm saying? Like, remember how we always think arteries carry oxygen-rich blood away from the heart, and veins carry oxygen-poor blood to the heart. But inside the heart, the blood is being carried by an artery, that pulmonary artery, to the lungs. And then it's being from the pulmonary vein back to the heart. You know it's pulmonary, you know it's lungs. If you see pulmonary, you know that means lungs. So if you see pulmonary artery, you know that's what's taking the blood to the lungs. So if you think, okay, arteries carry the blood, like it's important. You've got to get the blood to the lungs. That's important. So then it goes to the right and left lung and it comes back to where? Where's it coming to? The left atrium. It just comes back by way of the pulmonary vein. It's got to have a vein to carry it, right? Or an artery. This is another way that you can think about it. This little chart, it just gives you the exact like flow. And if you can memorize this, then you would know after it leaves this right atrium, it goes where? To the right ventricle. Then it goes to the lungs and it picks up oxygen. It's delivered back to the left atrium. It's delivered to the left ventricle and back to the bodies. If you can remember this little chart, all the other little things can be filled in. The valve, pulmonary vein, pulmonary artery. So if you can remember this, right and left, right atrium, right ventricle, left atrium, left ventricle, that's the flow. And it seems like it's a lot. It really, if you just draw a heart and draw that flow on it, it will help you memorize it. If you draw, like physically draw that out and divide it into 4 and draw your flow of blood. Because that's going to help you later when we figure out where does your electrical activity start? Well, where does my blood flow start? In the right atrium, right? That's where it all starts, right? Where's the first place it gets that blood that has to be pumped? The right atrium. So that's where your pulse rate starts. That's where the electrical activity starts. We haven't got there yet but that's how it all ties in together. That's why you have to know this part, because when you start to look at your EKGs and your electrical activity, we know that the pacemaker of this heart sits in the right atrium because it's getting the blood. That's where it's coming. That's what's triggering this heart to pump. Everybody have questions about that? Does that make sense, or is that just more confusing?
It's cut on, like, I can hear you, but it keeps cutting in and out, in and out, in and out, in and out.
Like the audio?
Yes, ma'am.
Is that with everyone, or is that just?
Not me.
I can hear you.
Okay. I wonder if it's just the connection.
I can hear you.
Might be my signal. I live down in the hole.
Yeah, and you know, if you call tech, they have like boosters, Wi-Fi boosters, or like the little boxes. They might be able to give you one. Because like for people who didn't have Wi-Fi or had like poor Wi-Fi, I know they had them when they started all this, and I remember Jessica telling me they had them. So you might be able to get like a Wi-Fi booster from them. I would call there and ask IT, because I had thought about that, because we're down in a hole too. So let me look at this. Oops. Uh-oh. Let's see. Y'all all got these, right, from me?
Mm-hmm.
Y'all probably shouldn't look at that yet. That's got your nodes in it, and I don't think you need to, you don't need to know that yet. Hang on. Hi, let's see. You should be able to label these like this. So this gives you a clear picture of this too. Like, what is this? If I gave you this without these on them, you'd be able to track this blood flow, correct? So where's the blood go? The blood is deoxygenated, right?
Superior vena cava.
It goes from, what's this one here? What's this? Where's this blood, this blue blood going from? You know, where's it come to? What kind of blood is this?
Deoxygenated.
I don't see a picture.
I'm sorry?
I don't see a picture.
Y'all don't see this? Y'all don't see this blank?
I see all the pictures in one page.
Yeah, there's a lot of pictures.
Well, let's just see. Maybe it's my computer. Hold on. Oh yeah, I think I'm like stuck here. Hold on. Wow. What the heck? It's telling me it needs a break. Hold on.
We need a break. What?
We can take a break. That is totally fine. I need more Red Bull, and clearly my screen does, because my screen is stuck. Okay, so we'll take like 15 minutes and this heart flow again. So just take whatever, 15 minutes. You want to take 15 minutes?
Sure.
Okay, we'll meet back here at 7:45. Maybe I'll get my computer to work. What is happening with this thing?
Leave my squirrel alone. Stop being a hater.
Mm-hmm.
I need to ground it down. I need some
Well, it's fine. My computer's locked up anyways. What's happening here?